Cats are very territorial and will fight other cats to establish their territory or to defend existing territory. As a result, fight wounds are very common in cats. A cat has many infectious bacteria in its mouth and can transfer those bacteria to another cat with a bite. These puncture wounds frequently result in a wound infection called an abscess. Bacteria from a bite trapped under the skin can multiply for several days before any sign of infection becomes apparent. Swelling and pain at the puncture site are the most common signs of infection. Many times the cat will also run a high fever. If loose skin is present around the puncture site, a pocket of pus will form around the abscess. If the skin is not loose, such as on a foot or the tail, infection spreads throughout the tissues and causes swelling and pain. This type of infection is called cellulitis. If an abscess goes untreated, it can result in serious complications, such as extensive tissue damage and scarring at the site of the abscess. An abscess that involves a joint can cause painful, permanent arthritis. Bacteria from an abscess may enter the bloodstream, causing blood poisoning that can severely damage the heart, kidneys, and other vital organs. The best course of action to take is to have your veterinarian treat all wounds as soon as they are noticed. In early stages following injury, antibiotics in the form of injections, pills, solutions, or ointments can be used to fight the infection. If the abscess has already formed, it will then be necessary to surgically drain pus and remove damaged tissue to help heal the wound. Abscesses in cats from fight wounds can be a serious matter. To prevent them, you need to have all wounds treated before an abscess has a chance to form. Unfortunately, these wounds may not be obvious, and you won't be aware of them unless you see or hear a cat fight. Try to keep your cat confined so that it doesn't have an opportunity to fight. And since male cats have a natural tendency to roam into other cats' territories, which results in fights, they should be neutered to reduce aggression toward other cats. In the course of grooming and petting your cat, be alert for fresh cuts or puncture wounds. If your cat has been in a fight, the most likely places to find bite wounds will be on the legs, back, base of the tail, and face. If an abscess has already started, one or more of the following clinical signs may occur. Your cat may run a fever, the ears and nose may feel hot and dry, and the appetite may be poor, or there may be a refusal to eat at all. Please be observant for all of these signs and call our clinic immediately. Cats that fight are at high risk for feline leukemia virus and feline immunodeficiency virus infection through the bite wounds. There is no cure for either of these fatal diseases, but vaccinations are available to help protect your cat.